Hi friends. Welcome to our channel Global Health Helpline. Today we will learn about a homeopathic medicine Arsenic Album from the book, Lectures on Homeopathic Meteria Medica by James Tyler Kent. It is the fourth part of this remedy. Please see next parts. The link is given in the description box. Please subscribe our channel to be connected with us. Let's begin. Eyes. The eye symptoms of this remedy are very prominent. In old cases of suppressed malaria, in broken down constitutions, in pallid, sickly people who are subject to general catarrhal conditions, and such catarrhal conditions as localize more especially in the nose and eyes, the eye symptoms will be troublesome. There are discharges from the eyes. It may be a conjunctivitis, in a general way involving the lids and the globe, going on sometimes to ulceration with thin, bloody discharge, increasing to thick, acrid discharge that excoriates the eye, making the canthe red and causing granulate. Ion with burning. The burning is better from washing in cool water and also better from dry heat. Very often ulcers appear on the globe of the eye, often upon the cornea. It has various kinds of hypertrophy beginning in patches that will form scars, and in old ulcerated patches little growth semel. As2 O3 pterygium growing towards the center of the eye and threatening blindness. The inflammations are sometimes attended with swelling, burning and excoriating discharge. This swelling is bag-like in character, and so we find baggy lids and little bags forming under the eyes. The face is waxy and pale, presenting the appearance of a broken-down constitution or a dropsical condition. The catarrhal state involves throat and nose, and it is sometimes difficult to separate the nose symptoms from the throat symptoms. The Arsenicum patient is always taking cold in the nose, always sneezing from every change in the weather. He is always chilly and suffers from drafts, and is worse in cold, damp weather, always freezing, chilled through. These pale, waxy, broken-down constitutions with catarrhal discharges from the nose on looking at a bright light become blind. Sneezing and coryza with inflammatory conditions through the whole nasal cavity, throat, larynx and chest. The cold begins in the nose and goes down into the throat, very often causing hoarseness with dry, tickling, hard, rasping cough. It is a difficult matter to find remedies for a coryza that begins in the nose and extends into the chest with bronchial troubles. Very often you require a change of remedy, as the chest symptoms often run to a different remedy. It is difficult to find a remedy that covers the symptoms of both nose and chest. Arsenicum is the remedy for old, chronic catarrhal troubles of die nose where the nose bleeds easily, and he is always sneezing and taking cold, always chilly and pallid, tired, restless, full of anxiety in the night and has troublesome dreams. The mucous membrane is easily inflamed, producing patches of red and ulcers that bleed easily. Great crusts form in the back of the nose. There is a striking tendency to ulcerate in Arsenicum. If it is a sore throat it ulcerates, if colds settle in the eyes, they may end in ulceration, catarrhal troubles in the nose end in ulceration. And this ulceration tendency, no matter where the troubles locates, is a very strong feature of Arsenicum. It is the remedy for catarrhal complaints of the nose and other places in broken down constitutions from syphilis or malaria, or a constitution that has gone through blood poisoning of some key. ND, either poisoning from a dissecting wound, or from erysipelas or typhoid fever or other zymotic states improperly treated, or poisoning with quinine and like substances that break down the blood and establish a state of anemia. If an ulcer comes upon the leg, if a leukorrhea comes on, if any discharge is established the patient is relieved thereby. Now let some of these discharges slack up and you have a chronic state apparently from retained secretions, but it is a form of blood poisoning. So it is with suppressed ear discharges, suppressed throat discharges, suppressed leukorrhea and ulcerations. Arsenicum is one of the medicines that will conform to the anemic state that follows each suppression. At the present day it is fashionable to use the cautery, to make local applications to stop leukorrhea and other discharges and to heal up ulcers. Now, when these external troubles go there is an anemic state established in the economy, the patient becomes waxy and pallid, sickly looking, and the say catarrhal discharges come on as a means of relief because of the suppression of some other condition. For instance, since the suppression of a leukorrhea the woman has had thick, bloody or watery discharge from the nose. It is frequently suitable to the constitution when an ulcer has been dried up by salves, or an old car discharge has been stopped by the outward application of powders. The doctor thinks he has done a clever thing in stopping such discharges, but he has only succeeded in damming up the secretions. Ick are really a relief to the patient. Such medicines as sulfur, calcarea and arsenicum are suitable for the catarrhal discharges that come from these suppressions, in broken-down constitutions. Arsenic is also like unto the condition that has been brought about from the absorption of animal poisons. It goes to the very root of the evil, as it is similar to the symptoms brought on from a dissecting wound. Arsenic and lachesis are medicines that will go to the cause at once and antidote the poison, establishing harmony and turning things into order. The nose symptoms, then, of arsenic are very troublesome and furnish an extensive part of the symptom image of an arsenicum patient. They always take cold easily, are always sensitive to cold, and the catarrh is always roused up on the slightest provocation. When an arsenicum patient is at his best, he has discharge more or less of a thick character, but when he takes a little cold it becomes thin, the thick discharge that is necessary to his comfort slacks up, and then he gets headache and on comes thirst, restlessness, anxiety and distress. This goes on to a catarrhal fever of 2 or 3 days duration, and then the thick discharge starts up again and he feels better, all his pains and aches disappear. It has been of great service in epithelioma of nose and lips. Inflammation of the throat and tonsils with burning, increased by cold and better by warm drinks. There is redness and a shriveled condition of the mucous membrane. When there is blood poisoning going on, as in diphtheria, an exudate appears upon the mucous membrane and it becomes gray and shrivel. Ashy colored, and this sometimes covers the whole of the soft palate and the arches. It looks withered. He is prostrated, anxious, sinking, weak, not a great deal of fever, but much dryness of the mouth. The catarrhal state goes down into the larynx with hoarseness, and into the trachea with burning, worse from coughing, and then comes constriction of the chest, asthmatic dyspnea and dry, hacking cough with no expectoration. This testing cough is attended with anxiety, prostration, restlessness, exhaustion and sweat, and the cough does not seem to do any good. The cough is the early part of it and keeps on as a dry, rasping, harsh cough for several days without doing any good. And then asthmatic symptoms come on, when B expectorates great quantities of thin, watery sputum. There is constriction about the chest, a great sense of tightness and wheezing, and he feels he will suffocate. Bloody mucus is expectorated at times, but the symptoms are more generally of a catarrhal character. Symptoms of pneumonia sometimes appear with the rusty expectoration. The expectoration is excoriating. There is in the chest a sense of burning, as if coals of fire were in the chest, and it goes on to bleeding and liver-colored expectoration. Arsenicum is a bleeding medicine, one that predisposes to hemorrhage, and bleeding takes place from all mucous membranes. Commonly of bright red blood, but in this region the parts take on a gangrenous state and the hemorrhages become black and there are little clots like portions of liver. The same are found in the vomited matter and in the stools. The expectoration is horribly offensive, so much so that you soon get the idea that there is a state of gangrene. The patient is at this time going into a state that perhaps cannot be any better described than a gangrenous inflammation. There will be signs to indicate the inflammatory condition, and there will be the smell of the expectoration which you will detect as soon as you open the door. The expectoration is a thin, watery fluid intermingled with clots. In the pan you will find this watery expectoration looking like prune juice, and in the midst of it will be clots of blood. The offensiveness is horrible. He has gone through the period of restlessness and is now prostrated, sinking, pallid, and likely enough covered with a cold sweat. Stomach and bowels. When we come to the stomach we find everything that may be called a gastritis, vomiting of everything taken, even a teaspoonful of water, extreme irritation of the stomach, great prostration, horrible anxiety. Dry mouth, a very little hot water will sometimes comfort him for a minute, but soon it must come up, cold fluids are vomited immediately. The whole esophagus is in a state of inflammation, everything burns that comes up or goes down. Vomiting of bile and blood. Extreme sensitiveness of the stomach is present, he does not want to be touched. Heat applied externally relieves, and there is a temporary relief from warm drinks, the heat is grateful. In the bowels we have much trouble, this remedy has all the symptoms of peritonitis, distension of the abdomen, a tympanitic state, cannot be handled or touched, yet he will keep moving because he is so restless, he cannot keep still, but finally he becomes so weak that exhaustion takes the place of restlessness. Dysentery is likely to come on, with involuntary passages of urine and feces, one or both, with hemorrhage from the bowels and bloody urine. As the bowels move, we get the cadaveric odor to the stool, a smell like putrid flesh. The stool is bloody, watery, brown like prune juice, or black and horribly offensive. Sometimes dysenteric in character with dreadful straining and burning of the anus, every stool burns as though there were coals of fire in the rectum. Burning it. The bowels, burning all the way through. The pain in the abdomen is better from the application of hot things. The tympanitic condition is extreme. Sometimes there is a gastroenteritis that takes on a gangrenous character that in olden times used to be talked about as gangrene of the bowel, a mortification that always ended in death. A thick bloody discharge is passed with a horrible odor, all substances are vomited, the patient desires to be in a very warm room, wants to be well covered, wants hot applications and warm drinks, looks cadaveric and smells cadaveric, with a dry, pungent odor that penetrates everything, but if he wants the covers off, wants a cool room and windows open, wants to be sponged with cold water, and wants ice-cold drinks, then he must have sacral core bowels. I want to warn you against the too promiscuous use of arsenic in the summer complaints of young babies for dysentery and cholera infantum. It has so many little symptoms that are so common to these complaints that if you do not look out and are not warned, you will be likely to give your patient arsenic, suppress some of the symptoms, changing the aspect of the case so that you cannot find a remedy for it and yet not cure the case with arsenic. There is a strong tendency to be routine and give arsenic without a sufficient number of generals being present, i.e., if you give it on particulars and not in the generals of the case. This medicine is full of diarrhea and dysenteric symptoms. In these conditions there will be the pallor, the anxiety, the cadaveric aspect and the cadaveric odors. In the dysentery there is most distressing and frequent urging to stool, scanty, slimy, black, fluid, inky stools with cadaveric smell, great prostration, restlessness and pallor. In the bowel troubles, in low forms of disease, the stool becomes involuntary. This is a condition of the rectum, a relaxation of the rectum, great prostration. Involuntary stool generally indicates either local or general exhaustion, and in this remedy there is terrible exhaustion, so that there is involuntary diarrhea in typhoid and in low forms of zymotic disease, involuntary urine. Purging is sometimes present in arsenic, but generally B does not have much purging, such as we find in podophyllum, phosphoric acid. Usually there will be little, frequent gushes, little spurts with flatus and D. The great exhaustion that occurs in cholera, little spurts with mucus, slimy, whitish stools. Arsenic is not so commonly indicated in cholera, i.e., during the gushing period, but sometimes after the gushing is over and the vomiting and purging have passed, leaving a state of extreme exhaustion. We have a state that appears like coma, the patient looks almost as if dead, except that he breathes. We find, then, that arsenicum will establish reaction. Cholera infantum with great prostration, sinking and cadaveric appearance, great coldness, covered with told sweat, cold extremities, cold as death, cadaveric, sickly, foul, pungent, penetrating odor in the room from the feces and urine and even of what is vomited. The passages from the bowels are acrid, excoriating, causing redness and burning. Very often the burning extends into the bowels. The rectum and anus burn, smarting all about the anus. It has tenesmus, painful, unbearable urging, great distress in the lower bowel, in rectum and anus, terrible state of anxiety of the patient, and the pain is so violent and the suffering so intense. The anguish so intense that he can think of nothing but death. The fearfulness and frightful feelings are such as he has never experienced in his life, and he feels confident these mean he is going to die. This, like all other complaints, is attended with restlessness, and when not at stool he is walking the floor, going from bed to chair and from chair to bed. He will get on the stool and then back to bed, then he is hurried to stool again, sometimes he loses it. Sometimes there is a chronic hemorrhoidal state with burning, and the hemorrhoids protrude when at stool. He is much exhausted after getting back into bed after a stool, with these protruding lumps which are like grapes and feel like coals of fire. They are hot, dry and bleeding. Fissures of the rectum that bleed at every stool, with burning, itching and eczematous eruptions about the anus with burning. This kind of pain may be felt anywhere in the body. Burning is characteristic of arsenic, stitching is characteristic of arsenic. Now, put these together and the patient often describes it as being stuck with red-hot needles all over him. This red-hot sensation, which is a common feature all over, is felt at the anus, and especially when there are hemorrhoids, burning and sticking like hot needles in the hemorrhoids. At times when a patent is coming down with the early stage of a violent attack, he will have all the rigor and chill that it is possible to find in the Meteria Medica and that can be found in disease. Rigors and chills of violent character, and at such times he describes a feeling as if the blood flowing through the vessels were ice water. He feels a rushing through the body of ice-cold waves. When the fever comes on, he is intensely hot from head to foot. Before the sweat has appeared, he feels that boiling water is going through the blood vessels. Then comes on the sweat and dyspnea and all complaints in which he is prostrated and becomes cold. While the sweat sometimes relieves the fever and pains, yet it is prolonged and attended with great exhaustion and does not relieve his exhaust. Ion. Many of his complaints are increased with the sweat, for instance, thirst is increased, the drinking is copious and does not relieve, it seems he cannot get enough and patients will say, I can drink the well dry, or, give me a bucket of water. Such things are indicative of the state of thirst. During the fever he wants little and often, during the chill he wants hot drinks. Arsenicum is a very useful medicine in the eruptions of the genitals with burning. In little ulcers that burn, even when they are syphilitic, herpetic vesicles that appear upon the foreskin and upon the labia, chancre or cancroids with burning, smarting and stinging, but especially in those that are weak, that offer no willingness to heal, but that do the very opposite, that sprea. D. Those that we call phagedenic, those that eat from their outer margins, become larger and larger. Ulcerations. Arsenic and mercure are the two principal medicines for spreading ulcerations such as eat in every direction, very offensive. Such ulcerations as follow the opening of a bubo in the inguinal region where there is no tendency to heal. A little, watery, offensive discharge keeps coming and extending, ulceration keeps spreading round about the opening, no tendency to heal. Or the patient has been in the hands of a surgeon who has passed his knife down the threatening suppurating bubo and it has been followed by red, angry, erysipelatous appearance and shows no tendency to heal. The edges have been removed by ulceration, and now the surface has cleared off, leaving a surface the size of $1, sometimes becoming serpiginous. These ulcers are sensitive to touch and burn like fire. Genitals. In the male and female sexual organs there are many symptoms of importance. In the male organs a dropsical condition, dropsy of the penis, edematous appearance, so that the penis is enormously swollen and looks like a water bag. The scrotum, especially the skin of the scrotum, greatly swollen and humid round about the parts. In the female the labia are enormously swollen with burning, stinging pains, hard and swollen. Erysipelatous inflammation of these organs, ulcerations, of a syphilitic character. These when such symptoms burning, smarting and stinging are present. In the female, violent, burning pains in the genitals with or without swelling, burning that extends up into the vagina, with great dryness and itching of the vagina. The leucoreal discharge excoriates the parts, causing itching and burning with great suffering. Whitish, watery, thin discharges that excoriate, so copious sometimes that it will run down the thighs. The arsenicum menstrual flow is very often excoriating in character. Copious leucoreal flow intermixed with menstrual flow, very profuse and very acrid. Suppressed menstruation going on for months, amenorrhea in prostrated, nervous patients, wrinkled, careworn, haggard facet. Of course, arsenic has a wonderful reputation in the old school for anemia, and it is said to be as good as ferrum for anemia. Ferrum and arsenic are the strong drugs for anemia, so that it is not to be wondered at that these pallid mortals find benefit from arsenic. During menstruation, stitches in the rectum. Leucorrhea acrid, corroding, thick and yellow, etc. After parturition the woman does not pass the urine, no urine in the bladder, suppression, or the bladder is full and it does not pass. In connection with this subject you will find causticum the most frequently indicated remedy when you go back and the woman has not passed the urine and it is time that she should. You will frequently find it indicated when you have no other symptoms to go on. Aconite will be more frequently indicated than any other remedy if the infant has not passed the urine. This is keynote practice and is to be condemned when there are other symptoms to indicate a remedy. If there are no other symptoms study aconite and causticum and see if there is any reason why they should not be given. Cancer. Another feature in connection with the woman, arsenic is a wonderful palliative in cancerous affections, such as occur in the uterus and mammary glands. Burning, stinging pains have entirely disappeared, in incurable cases, of course. It becomes one of the palliatives. Larynx and chest. Arsenic has loss of voice, laryngitis, with dry teasing cough, a cough that does not seem to do any good. Hacking constantly, dry, hacking cough. Study its relation to asthma and difficult breathing, dyspnea. Arsenic has cured some long-standing cases of asthma of a nervous character, asthma that comes on after midnight, in patients who suffer from the cold, those who are very pallid, dry wheezing sue. Must sit up in bed and hold the chest, anxious restlessness with prostration. The heart symptoms are troublesome to manage when they get to be like arsenic. The symptoms correspond to a state of great weakness, great palpitation, palpitation from the least exertion or excitement, great anxiety. Anguish, weakness, he cannot walk, he cannot go upstairs, he can hardly move without increasing the palpitation, every excitement brings on palpitation. Severe paroxysms of palpitation or attacks of syncope during endocarditis. Quote, Arsenicum corresponds to most serious complaints of the heart, corresponds to many of the incurable complaints of the heart, that is, when you see arsenic corresponding in all of the symptoms with these marked cardiac affections, dropsy of the pericardium, etc. You have a class of cases that are very serious. Angina pectoris, etc. Rheumatism affecting the heart, etc. Hydropericardium with great irritability, etc. Pulse frequent, small, trembling. Pulsation through whole body, etc. Again, this goes on to another state when the heart becomes weak, pulse thread-like, patient pale and cold, covered with sweat, pulse very feeble. When this is not a state of the heart itself, then arsenic becomes a wonderful remedy. That is, it is capable of cure. Fever. I want to say a few things concerning a few essentials, some few things most general to the arsenicum type of intermittent. You can read the general state of intermittent fever and fevers generally and apply what has been said. Arsenic has all the violence of the chill that you can find in any remedy, with excitement, headache, prostration, dry mouth, desire for hot drinks and to be covered up warmly, with all the anxious restlessness and prostration that you can find in any medicine. But the time of the arsenic case is an important thing. A striking feature of the arsenic time of chill is its irregularity, coming not twice alike, coming at any time. It has afternoon chill and after midnight chill, sometimes in the morning, sometimes at 3 or 4 p.m., sometimes at 1 p.m. It has a striking periodicity in its nature. Hence it has an intermittent nature. It has a striking feature of thirst. During the chill, while there is sometimes great thirst, he has aversion to cold things, hence can take only hot drinks, hot teas, etc. During the fever the thirst increases because he has dry mouth, and he drinks little and often, just a teaspoonful to wet his dry mouth. Water does not quench his thirst, for he wants but a tablespoonful, little and often. This runs on into the sweat with prostration, increased coldness, desire for copious drinks, unquenchable thirst for cold drinks. The chill is attended with great aching in the bones, likely to commence in the extremities, and during the chill there is a great head congestion with purple fingers and toes. Put these things together in the prostration that occurs with the awful anxiety, and you can most always in a general way pick out the arsenic case. But it has so many details in its chill, fever and sweat that if you take the details of symptoms and leave these general features out you'll be likely to be able to cover almost any case of chills, i.e., you may think you will, but unless some of these general nates are present that stamp it as arsenic you will fail. It is one thing to stamp the whole case as arsenic and another thing to say that these are arsenicum symptoms. So it is with china and quinine, they have numerous particular symptoms, and yet to make the case a china or quinine case the striking general